Hey everyone, it is Ken, your Medicare guy here. We have some amazing news coming out ahead of Medicare annual enrollment from the great people at Modern Healthcare. Amazing publication. Definitely recommend checking them out. We're going to be talking about the potential changes to Medicare.gov that could be happening in just a few weeks. So if you've never been here before, we're NJ Life and Health. We focus on Medicare, life insurance, a lot of other insurance related topics. We're going to be going over a great Medicare one for you today. Please like and subscribe. More about us later. We're going to dive right into this amazing article. CMS rolls out last minute changes to Medicare Plan Finder. CMS, if you don't know, is the overarching government body, the Centers for Medicare and Medicaid Services, that run a lot of the government based healthcare initiatives in this country. Currently headed by Dr. Oz. And what they're talking about, they are currently headed by Dr. Oz, and they are asking insurance carriers to do a couple big things ahead of AEP, which starts October 15th, but in a lot of ways it's already started because the companies have already started sending out letters to clients about potential changes in the next couple weeks. October 1st, all the plans become public, so we're really only a few weeks away from the first step of this, which is companies sending out their annual notice of changes. So this is really at the 11th hour. So we're going to be diving in and explaining how your Medicare annual enrollment experience could be changing. So I'm going to be reading this to you guys. A little over a month before the annual enrollment period, the Centers for Medicare and Medicaid Services is urging Medicare Advantage insurers to make significant changes to how they present their offerings to beneficiaries. Perhaps most notably, CMS will incorporate provider network lists into the Medicare Plan Finder tool enrollees use to select plans it notified insurers last month. The agency is simultaneously developing a national provider directory that will not be ready in time for the 2026 Medicare Advantage and Part D sign-up campaign, which runs October 15th to December 7th. CMS also intends to add more details about Medicare Advantage supplemental benefits and a prescription drug pricing search tool powered by artificial intelligence. They are hoping that insurance companies build a provider search tool into their actual Medicare.gov website. If you've ever been to Medicare.gov and you want to look up a Medicare Advantage plan, you can see all the Medicare Advantage plans available in your zip code in your area. And they do list a lot of different things like the copays for certain procedures. They list some of the supplemental benefits and everything like that. But if you want to see if your doctors take a particular plan, you have to go to several different websites for several different insurance carriers and kind of cross compare, make a spreadsheet. It's a very tedious thing. It would be amazing if people can just go to the Medicare.gov website, type in their doctor, and see, okay, these three plans I'm interested in, these two actually take my doctors, and this one does it, and they'll be all side by side. So again, this is an amazing development. We're really hopeful for this. They're also being a little more upfront about the supplemental benefits. A lot of times, if you're looking at a plan, they'll say there's supplemental benefits, but they won't exactly give all the details. So again, this is an added development. This could hopefully give more specifics about dental benefits, over-the-counter card benefits, transportation benefits, because as it stands now, in most cases, you kind of just see, hey, this benefit exists, like it could be transportation, and you might assume, oh, that means I can go to transportation wherever and whenever I want, but really there's like a limit of, let's say, 10 for the entire year. So again, this is something to keep track of. We're really hopeful that this is going to have a lot more transparency in the Medicare Advantage space. The other piece of this is an AI tool that helps with prescription drug pricing. This one's a little bit interesting because the drug pricing is already very transparent. It's just very hard to understand. I don't know if adding this AI tool is going to change too much. The prices are on there. It's not so much that you can't find the prices. It's just very hard to interpret what they are in most cases. So again, welcome development. We're here for any potential developments that make your life easier as a Medicare enrollee. It's just hard to understand how that's actually going to make things better and move the needle for Medicare enrollees. These are the most significant additions to the Medicare Plan Finder since its launch in 2005, said Helene Fingold, a health insurance attorney at the law firm Epstein, Becker & Green. I would consider it a landmark change. I 100% agree. CMS contracted with technology vendor Sunfire Matrix to assemble their provider list for individual Medicare Advantage plans, but is strongly encouraging health insurance companies to share their own data, the agency wrote in a memo distributed August 25. So Sunfire Matrix, so you guys know, is something I have access to as a broker. And this thing we're talking about where you can compare if certain doctors are in multiple plans is something that Sunfire does. So essentially, what Medicare has done is reached out to one of the biggest resources for Medicare brokers and say, we want that technology for everybody. And I actually think that is a pretty cool development. Currently, Medicare Plan Finder does not include data on Medicare Advantage provider networks, resulting in Medicare beneficiaries having to navigate to other sources of information to determine if their preferred doctors and hospitals are in network for a particular plan, the memo says. Absolutely true. The update to the Medicare Plan Finder aligns with President Donald Trump's efforts to promote transparency in the healthcare system. It could shake up the Medicare Advantage market, says Betsy Seals, principal and CEO at Alarian Advisors, a healthcare consulting firm. It's an attempt to course correct and create a competitive environment to incentivize plans to get the data right and get the data posted. We may be surprised at who's the winner and who's the loser in this initiative. On one hand, smaller and regional Medicare Advantage carriers may benefit if enrollees have an easier time determining if their preferred providers are in network, what extra benefits they can get, and how much they will pay for medicines. On the other hand, market leaders such as United Health Group subsidiary United Healthcare and Humana have greater resources to devote to collecting, updating, and sharing detailed information about their coverage. So all very interesting points. We're essentially seeing this is a new initiative. Obviously, none of it is really totally binding at the moment, but this could be a huge thing for these local regional carriers to really promote transparency. And rather just looking at this big national brand name, people can have a more transparent search and say, okay, well, this person takes my doctors, this small regional carrier also does. Okay, wow. These are the benefits for the big national company. These are the regional ones. Oh, wow. But the reverse could be true. These small regional carriers, they're trying to expand. They might not have the same revenue. They might not have the same budget as one of these big companies might have. And they may be able to show an even better experience because they have more resources to do so. So while we're not really sure how this is going to shake up the market, it definitely will, especially if only a couple people are truly participating with it. Submitting provider directory information would prove challenging to the entire sector at a time when profits are shrinking, federal payments are smaller, and federal oversight is more stringent, said Allison Reiser, Chief Growth and Innovative Officer at ATI Advisor, a health insurance consulting firm. They may simply not have the bandwidth unless there's a significant competitive advantage, Reiser said. Health insurance companies have long struggled to maintain a current list of their network agreements, as the persistence of ghost networks that include non-participating providers illustrates. So this is a very interesting point. They're saying that they might not have the bandwidth, but I kind of think it's the opposite. If people can just look up their doctors easier, they're probably going to have less issues in the long run. Some of the biggest complaints we have with Medicare Advantage plans is people wondering, I have 5 doctors, does my plan have all of them? Are doctors leaving the network? Or they go to a doctor and after the fact find out that they're not in network, and it creates billing and claims issues. It is possible, and all said and done, the investments these companies make in getting the data right and giving the data to the general public might actually make their lives easier in the grand scheme of things. Nearly half, or 48.7%, of Medicare Advantage plan directories contained incorrect information in 2018, according to the most recent federal review. Not surprising. Recent lawsuits offer a discouraging view of whether insurers have fine-tuned their data since then. Last month, Cigna paid an undisclosed sum to settle accusations it failed to maintain an up-to-date list of in-network providers. Elevance Health and Centene face similar class action lawsuits from patients who allege their inaccurate directories constitute marketing fraud. What I can tell you guys is anecdotally, we have seen a ton of times when directories are not correct. So usually when someone comes in and has a Medicare Advantage plan, they're, wondering, should I stay in my current one or should I switch to a new one? We generally tell people to go to their doctors directly because these directories are oftentimes not up to date. A lot of times contracts also can break mid-year. So this is something that really needs to change. Instead of this directory, I would prefer that all contracts end at the end of the calendar year and people are given a heads up to changes. Like, let's say all contracts have to be negotiated by October 1st of each year, because one of the biggest issues is people choose a plan, a Medicare Advantage plan, because they like a network, and then the contract between their provider network or their local hospital is up in, let's say, June. And then they can't necessarily switch the Medicare Advantage plan mid-year. So this is one of those things where while we're making this more transparent, we also have to kind of think about the gears and the machinations of this industry and say, okay, all contracts between providers, hospital networks, anything you want to say should be for the end of the calendar year. In January, CMS proposed rectifying the problem by mandating that Medicare Advantage insurers add provider directories to the Medicare Plan Finder. The agency abandoned the idea after facing pushback from insurers. Even if insurers add their network agreements to the shopping tool, there is no guarantee it would help consumers make coverage decisions, said Michael Bagel, Vice President of Policy at the Alliance of Community Health Plans, a trade group for nonprofit insurers. When the first Trump administration revamped the Medicare Plan Finder in 2019, beneficiaries and enrollment staff reported the website malfunctioned and displayed inaccurate information. I think that was only for a couple days. I don't think that was anything crazy. So I will say I was not a licensed insurance broker when that happened, but I can tell you that sometimes at the very beginning of AEP, like the first couple days when all these plans get released, like Medicare just totally goes down. But I can tell you from experience that in a lot of cases, there's so much traffic at the beginning of AEP, especially the first couple days, like October 1st, which isn't AEP, but it's when people release the plans. There's just so much traffic, the website crashes. So that might have just been a more technical glitch. The question is going to be like, how usable is that information once it's released, Bagel said. Very true. Similar efforts to promote comparison shopping, such as the Star Ratings Quality Score program, have failed to substantially alter consumer behavior. This year, 23% of individual Medicare Advantage members switched plans despite a record number of companies withdrawing their products, according to a deft research analysis of CMS data. That compares to 16% of individual Medicare Advantage enrollees who switched plans for the 2024 plan year when the market was more stable. It's interesting because they're saying a lot of people switched Advantage plans last year, but also a lot of plans were pulled. The reason people switched Medicare Advantage plans so much last year was because a lot of plans went away. So you really don't have a choice in that instance to stay with your current plan unless you want to go back to original Medicare. These are not opposing ideas. These are connected. You know, last year, a ton of plans went away. A ton of plans were what's known as non-commissionable, which is basically they take away broker compensations. They're like, we're keeping this plan for regulatory reasons, but we don't want people to take it. So a lot of this churn, at least in our eyes from last year, we don't have any specifics. It's too early in the process. But last year, a lot of plans went away. The insurance companies incentivized people to not take because they didn't want people to take them. And, you know, that is why there was so much churn last year, at least in my opinion. We'll see what happens this year. Obviously, we're still waiting for all the details to come out October 1st. But we'll just keep an eye on this for you and we'll make sure that everything is okay. Now, that is it, guys. What do you think about all these plan changes? Are you excited for more transparency on the specific Medicare.gov website because you won't have to go to every single insurance carrier's website and look through their specifics? Are you worried that not enough people are going to adopt this and it's going to end up being a bit of a nothing burger? Please let us know what you think in the comments below. If you like news like this, like and subscribe. Let us know how you feel. And if you want to work with Medicare brokers that truly care about you and have your best interests at heart, you're going to want to work with the people at NJ Life and Health. We are a local family-owned brokerage here in Toms River, New Jersey, but we're licensed in 29 states if you're watching us from a different one. So please call us. There's a chance we can help you. And what we'll do is we will sit down with you, we'll have a Zoom call with you, we'll have a phone call with you, and we'll go through all your specific situations. We're patient, we're understanding. We really want you to fully understand as much as you can about the Medicare system where you're currently at, what your options are if you want to switch, and we want to work with you for life because that's what we want to do. We want you to be part of our family. We have helped over 5,000 people across 29 states, and we would really love to help you as well. And the beauty about what we do is if you call us and we're not a good fit, we are not going to load you with spam calls. We know how crazy this industry is in relation to marketing and spam. We want to make sure you're not bothered by us. You can have someone you can reach out to, but it isn't necessarily going to go crazy calling you. So please let us know what you think about this video. Please reach out to us if you have a second. And as always, my name is Ken, your Medicare guy, and I will talk to you soon.